This talk is an overview of the Unified Protocol for Transdiagnostic Treatment of Emotional Disorders. The Unified Protocol, or UP, is a therapy protocol based on the concept that mood and anxiety disorders are all essentially based on the same problem, dysfunctional emotion regulation. Therefore, the UP uses a CBT approach designed to improve emotion regulation skills and treat any problem involving dysfunctional emotion regulation, regardless of diagnosis. The UP has been shown to be particularly effective for depressive disorders and anxiety disorders. Next, I'll outline the core principles of the UP as outlined in the Therapist Guide authored by David Barlow and colleagues. The 5 core principles are emotion awareness, cognitive flexibility, behavior modification, physical awareness, and emotion exercises. Emotion awareness involves learning to identify and track emotions. Patients are taught the 3-part model of emotions, in which emotions are made up of thoughts, behaviors, and physical sensations. You can see that this is similar to the CBT model demonstrating the interconnectedness of emotions, thoughts, and behaviors, but with physical sensations substituted for emotions. Also note that the 3 principles after this, cognitive flexibility, behavior modification, and physical awareness, each deal with one of these 3 parts of an emotion. Therefore, this first principle sets the groundwork for the rest of the UP. In this first principle, patients are also taught to practice the mindfulness skills of present moment awareness and non-judgmental awareness. Cognitive flexibility involves learning to identify and track thoughts, specifically automatic thoughts. Once the patient is able to track their automatic thoughts, they are then taught to evaluate them in terms of cognitive distortions, and through the process of cognitive reappraisal, develop more flexible, helpful, and healthy ways of thinking. Behavior modification involves learning to identify and track behaviors, specifically emotion-driven behaviors, abbreviated as EDBs. After becoming more aware of their EDBs, patients practice the skills of response prevention, learn to engage in alternative, more adaptive behaviors, and overall practice reducing avoidance through behavioral activation. Physical awareness involves learning to identify physical sensations associated with emotional experiences. This is also known as interoceptive awareness, which essentially refers to having awareness of internal sensations in the body, such as heartbeat, breathing, and hunger. Interoceptive exposures are emotional experiments designed to cause physical sensations associated with anxiety and psychological distress, which helps the patient to develop tolerance to these sensations. Finally, emotion exercises involve synthesizing all of the skills learned in the earlier principles and applying them to deal with real-life distressing situations via stepwise, gradual exposures. That's the end of this talk. There's much more to learn about the Unified Protocol, and I hope this framework helps to organize your knowledge. Thank you.